Okay, this is 7 days after rotator cuff surgery. Again, Brad LaVoy here, and I'm going to go over, I'm going to have to get down a little bit so you can see me, because I'm going to be back in to do some exercises. But I had physical therapy for the first day today, and my physical therapist gave me some very easy on my shoulder passive exercises so it will not fire the shoulder muscle. Now, I had a massive tear in my shoulder. I actually had 2 torn tendons, and I may be stuck in the passive exercises for probably 4 to 6 weeks. Many other people will graduate to more active use after about 4 weeks. But it looks like the course of action is going to be very conservative. The good news is they think there's a very good chance for full recovery and full function, which is what I'm looking for, obviously, as all of you are as well, as we're going through the same thing. The main thing is, especially the first few weeks, is not to do anything that will cause it to re-tear. In fact, my physical therapist related a story about an individual who, about 6 weeks after surgery, was out of a sling, was thinking things were good. He was starting to do some active motion with the arm. Again, active motions when you're firing it up and down like this. And decided to go and lift a 100-pound weight for whatever reason. He retore it back in surgery, and the story was that his surgeon was quite irate that he went and ruined all that work and has to go through it again. I'm not going to let the same thing happen to me, and I'm going to follow my physical therapist's advice. So, a few variations on the exercises that I showed you a few days ago. Let me stand up here. So, for passive shoulder exercises, he said the best way to do it is to imagine your arm is literally just dead. You not to fire it at all, and first just let it hang. It's like gravity hang, so my right arm is hanging, not firing at all. Now, in order to start doing some of these motions, and you notice my left arm I'm propped against the chair so I don't fall over, although that would make for a very funny YouTube video, I'm going to start, kind of like Elvis Presley, I know that's funny, swaying my hips back and forth, and I'm going to let momentum move my arm. I'm also going to go back and forth, just by using my hips and my legs. So my arm is swaying. This actually feels pretty good because it's lubricating the joint and the muscle and the tendon. By going back and forth, by letting gravity and momentum do the work, my arm is getting stretched, it is getting exercised without actually firing that muscle. Now I'm supposed to be doing this 2 to 3 times a day. The other thing they told me is even though I'm really not in any pain right now, is to keep icing it. So I'm going to have an ice in a couple of days and going back to icing it 3 or 4 times a day, and that will help promote healing. And I'm going to do this for, I won't do it here, but I should do it for about 2 minutes or so. So the next thing I'm going to show you, bring the chair back up. Let's see how this works. I think we can make this work. I'm turned to my side, and I'm going to put my arm is now sitting on my leg. If you can see, I have my hands rotated out. So my palm is up. I'm going to do 10 very easy, basically bicep curls with no weight. Luckily, my bicep tendon was in good shape. So right now I feel a little bit of tension in the shoulder, a little bit of tightness, but no pain. As long as I don't feel pain, it's fine. And so I'm going to do 10 of these. I'll do 5 of these in the interest of time. The next thing is I'm going to move my arm, I'm going to rotate it to more of a thumbs up position, and I'm going to do the exact same thing. This, as well as the pendulums that I showed you a couple minutes ago, I'm going to be doing about 3 times a day. And the other thing is just to move the wrist, to flex it, all without firing this shoulder muscle. It's okay to use my biceps, so this is okay. I don't want to be punching my shoulder. I don't want to be going back and forth. I don't want to be doing anything like this. Literally, he said, imagine your shoulder is dead and it's paralyzed and you cannot move it. Now, I've been a little too active, not badly so, but I've been a little too active in terms of some of my activities. So I have to be able to back off a little bit. It's not easy for me, it probably won't be easy for you either. I'm a pretty self-sufficient guy, I like to do my own thing. I hate getting help from people unless I absolutely need it. And so having to ask my wife to help me get dressed or put my sling on, I've been trying to do it myself, and I've been able to. But by doing so, I've also been using my shoulder in ways that aren't good. He doesn't think I've done any damage, but he said you have to really back off, resist the urge to overdo it, and that's the way that I'm going to end up with a full recovery. So, being hopefully a pretty smart guy, I'm taking that advice to heart. So, a week out, I get my stitches out tomorrow and get to meet with the doctor, actually a physician assistant, but he was in the surgery, so I can get a sense for how things went. I did get a chance to look at some of the notes from surgery. The tears were massive, they were complicated, but it looked like everything was put back where it was supposed to be, and looked like it was going to be a successful outcome. Again, as long as I am diligent about pursuing my therapy and not overdoing it. So, any other things? Pain, basically 1 out of 10, hardly any pain. Unlike what I've been hearing, and I've been on YouTube checking with other people and some people who I know as well. And one thing that's common is a lot of people feel quite a bit of pain from the surgery. I'm very lucky that I haven't. My therapist thinks that because I'm in basically good shape and because I'm not that old yet, I'm 45, that is in my favor. So I have a few things going for me. He said you have a big bone structure. That's helpful as well because they can sink the anchors in deeper. And typically that helps things heal and heal a little bit better. So pain, not really a factor. But still in the sling. It's only been 1 week, so I'll probably be at least 4 more weeks, perhaps up to 6 weeks in the sling. I'm going to see what the doctor says tomorrow. So that's about it. Just want to give you a quick update. It is October the, what's it? Today's the 10th of October, so yeah, a week out of surgery. So a week on the journey to recovery. And be back with you in a few days and let you know how things are going. See you later.